It's about the environmental tobacco smoke in relationship to bladder cancer risk. Cigarette smoking is an established risk factor for bladder cancer, and it's accounted for about 50% of the disease burden in the U.S. And the elements in the tobacco smoke is a known carcinogen to the urinary bladder cancer. Environmental tobacco smoke, also known as ETS, contains detectable levels of several elements. It has been shown that non-smokers who has been exposed to ETS, which is secondhand smoke and passive smoking, has a higher levels of biomarkers of tobacco carcinogens than those non-smokers who has never been exposed to ETS. And these elements requires metabolic activation to exert their carcinogenic effect. There are two enzymes, that is P450, 182, CYP182, and NAT2, that are critical isoenzymes to catalyze the metabolic activation or detoxification pathways of the tobacco pre-carcinogenic elements. So based on this fact, we hypothesized that ETS may render risk for bladder cancer. Also, the magnitude of the association may vary due to the genetic determined factors. So we test our hypothesis in the Shanghai Bladder Cancer Case Control Study. The Shanghai Bladder Cancer Study enrolled 581 bladder cancer patients aged 25 to 74 at diagnosis in 95 to 98, and 604 healthy community control subjects who were matched in frequency by gender and by 5-year age group. We used an impersonal interview to test for the 202 bladder cancer patients and 268 control subjects who are lifelong non-smokers. We obtained the demographic and lifestyle information, as well as the detailed information on domestic and occupational history of ETX exposure. For example, we asked each of the subjects about the source of their ETS exposure in a domestic setting, like the mother's father, son, daughter, spouse, other relatives to live together in the same household, as well as the co-workers in the indoor environment, in the occupational setting, of their habits of smoking, especially the number of years of smoking and number of cigarettes smoked per day. And we asked the subjects to donate urine samples. From the urine samples, we test the CYP182 and NAT2 phenotype status, and that is determined by specific caffeine metabolized in the donated urine sample. So based on the self-reported exposure to secondhand smoke, we can see that the non-smokers who has ever been exposed to ETS from either domestic or occupational settings, compared to those who has never been exposed to ETS, they have a general 20 or 30% increase of bladder cancer risk. In here, we show the domestic settings and occupational settings of the pack years of smoking, which is the number of cigarettes smoked per day times the years of smoking of each of the source to the subjects. We can see that from the if the subjects was living with in the childhood living with a mother who smoked in a heavier pack years category, that is involved with a 3.5-fold of the risk of getting bladder cancer. Other relatives also involved with some increasing in bladder cancer risk. In the occupational setting, we show that the hour years of smoking, that is the hour of the subjects working in that indoor place with ETX exposed, at times the years of the subjects working for that job. And we can see the higher intensity of ETS exposure is associated with a 1.65 times the risk of getting bladder cancer. So we created a cumulative index of ETS exposure. That is, we assign a number of 0, 1, and 2 to each source of the smoking of non-smoker of no smoking lower levels, that is 1 to 10 pack years of smoking, and more than 10 pack years of smoking. We assign the number to each source and accumulate all these sources together to get the cumulative index of ETS. Also, we assign the number of 0, 1, 2 to the coworkers who smoke no smoking, lower levels, and higher levels, heavier smokers. So we add this, we sum up all this index to create the cumulative index, and we can see that there is a monotonic increasing trend of risk to get into developing bladder cancer with each additional levels of ETX exposed. With the highest level of the most intense passive smoking of 2.28 times of getting bladder cancer. When we study the passive smoking and bladder cancer risk by CYP1A2 and NAT2 phenotypes among the non-smokers, we can see that compared to those subjects who has never been exposed to ETS, the non-smokers who has been exposed to ETS with a higher activity CYP1A2 phenotype or a slow as to lighter NAT2 phenotype are at higher risk of getting bladder cancer. Each of them is associated with a 1.5 or 1.9 fold of risk of getting bladder cancer. So we call the high activity level of CYP1A2 and slow acetylation type of NAT2 as risk factors, a genetic determined risk factor for bladder cancer. Then we study the combined phenotype of CYP1A2 and NAT2. We made 3 categories. The first one is with subjects with no genetic risk factors of CYP1A2 or NAT2. That means they have low CYP1A2 activities or rapid type of NAT2. The second category is one additional risk factors, that is either the high activities or the slow activity for NAT2. And the third category is the subjects has both the risk factors. So we can see there's also a monotonic increasing risk of getting bladder cancer with the most unfavorable CYP1A2 and NAT2 phenotype subjects of 2.1 times of risk of getting bladder cancer. And also this is with each of the additional risk factor, genetic risk factor added, there's a statistically significant trend of getting bladder cancer. So our conclusion is that ETS, especially from the smoking of mothers who usually occurred in the childhood of the subjects, was associated with an increased risk of getting bladder cancer among the left lung non-smokers. Among these left non-smokers who were exposed to ETS and possessed the most unfavorable phenotypic profile determined by the CYP1A2 and NAT2 index scores, they had double their risk of getting bladder cancer. Therefore, ETS may render even higher bladder cancer risk to individuals with an unfavorable genetic profile involved in the metabolism of the tobacco bladder carcinogens. I have some acknowledgments. Dr. Jianming Yuan, who is also in the audience, is the PI of the Shanghai Bladder Cancer Study. And we have some people involved in collecting data from the Shanghai Cancer Institute. Thank you.
Thank you very much.